Thank you everyone for joining us today. We will begin in just a few seconds to allow people to enter the room before we get started. Thank you again, everyone, for joining us today. We will begin in just a few seconds to allow people to enter the room before we get started. Welcome everyone, and thank you for joining us for today for the launch event titled Facing Forward, Amplifying the Stories of the Global NCD Community to Inspire Change. I'm Christina, and I will be your technical facilitator today. For assistance, please use the chat function to message anyone with the title Technical Facilitator in their name. Before we get started, I have a few technical notes to explain. If you would like to contribute a perspective, idea, or thought, please use the chat function. Please also note that this session will be recorded for documentation purposes. Spanish language simultaneous interpretation is available during this session. The feature has already been activated and is available by clicking the interpretation button at the bottom of your screen, where you can select the language that you would like to hear today's webinar in. For those of you just joining us, welcome and thank you for attending the report launch today. I will now pass the floor to Ms. Gemma Jennings, Global Head of Partnerships, BBC Global News. Ms. Gemma, the floor is yours.
Thank you so much. Hi everyone, and welcome to Facing Forward, Amplifying the Stories of the Global NCD Community to Inspire Change. My name is Gemma Jennings and I'm Head of Global Partnerships here at BBC StoryWorks. On behalf of the whole BBC team, I'd like to thank you all for tuning in today for what promises to be a very interesting, insightful and heartfelt discussion. We first started speaking about storytelling with the NCD Alliance and with the international health and development community back in 2019 when the world was quite a different place. We knew then that powerful stories, expertly told, might serve to place a much needed spotlight on the burden of non-communicable diseases. And we felt that there was a role to play for the media industry in partnership with experts across the globe in bringing those stories to screen. But we couldn't have predicted the impact of COVID-19 and the implications for people living with or at risk of NCDs, nor could we have appreciated just how urgent the need for action would become. Amongst the challenges of a global pandemic, our creative teams have been fortunate enough to work with a wonderfully diverse and inspiring set of individuals from across the NCD community. And together we've attempted to capture the very personal stories of those whose lives have been directly impacted by these diseases. Today, the culminations of those efforts will be shared with our global audience as we launch Facing Forward, a new series of films, articles, explainers, infographics, audio stories, and the Accelerating Health podcast. Facing Forward has been produced for the NCD Alliance by BBC StoryWorks with the aim of providing an immersive and in-depth consideration of the challenges faced by people living with NCDs, whilst also presenting the scalable and sustainable solutions being led on a global scale. It's been a fascinating project, and we hope that you will all engage with the series on bbc.com. Thank you to everyone involved in the making of Facing Forward, and especially to the NCD Alliance for their support, ideas and enthusiasm, and to every person who invited us into their world and allowed us to tell their story. And I'm so pleased that we're joined today by panelists who've been integral to the project and by our expert moderator, award-winning health journalist, Jackie Thornton, who I'll hand over to in a few moments. But before I do, just a few final points of housekeeping to note. Firstly, should anyone have any problems following us on Zoom, we're also broadcasting on the NCD Alliance Facebook page, so you can watch and engage with the session live there. Secondly, I encourage you all to participate in the conversation today, and you can do that by commenting in the chat box on Zoom and by sharing your views on social media, tagging @NCD Alliance and using the hashtags #FacingForward and #ActOnNCDs. Thirdly, this event is being recorded and will be made available to everyone in a few hours' time, so you are very welcome to listen back at your leisure. And finally, today is meant to be a conversation starter to inspire us and to challenge us. The Facing Forward site on the bbc.com hub site is now live, and I encourage you all to spend some time watching these beautiful and moving films, reading about the people who are affecting change, and listening to stories from the heart of the NCD community. And to give you a taster, we'll now play a short film from the series before Jackie introduces you to our fantastic panelists to start the discussion. Please enjoy From Small Steps to Systemic Shifts, a short film from the series set in Bulgaria and produced with the help of the World Heart Federation and World Obesity. Thank you.
Виж колко са еднакви, сега ще ти покажа колко са еднакви. Но яйчници са много еднакви. Може да ги различи? Ето. Аз ги бъркам. Христо и Йордан са това. Повечето родители казват стани като мен, аз им казвам не ставай като мен. Аз мисля за храненето и за моето затлъстяване нон-стоп. Във всяка една минута от моя живот то ме следва. Той е като сянка, аз не мога да избягам от него. Аз съм Десислава Христозова, журналист съм в Националната телевизия на България. Мен от малка ми казва, ти си дебела, това не ме направи слаба жена. Напротив, това ме караше да хода да ям още повече, за да забравя. Да забравя, да ми е по-сладко, да се изключа от света, който ме мрази. Това наистина е една пандемия, която много тихо, но много сигурно се прокрадва в телата ни и не само в нашите тела, а и в целия начин на живот.
Obesity is a major risk factor for cardiovascular diseases. Obesity is maybe the first sign that something is going wrong because of the predisposition to develop diabetes, lipid disorders, and so on. If you have wrong eating habits in the early adulthood, in childhood, then it became very difficult to correct them. Cardiovascular mortality is leading cause of that not only in Bulgaria, also in Europe and all over the world, especially in developing countries. It's our task to start prevention as soon as possible to avoid development of obesity, especially in young population.
Аз дигам високо кръвно, имам инсулинова резистентност, болят ме костите, болят ме коленете, съм на 40 години. Не знам какво ще се случи на 60. Отслабването не е просто сваляне на килограми. Това е промяна на живот. И затова е много важно твоя лекар, който те следи, диетолога, да знае ти как се чувстваш и емоционално.
Тоест подлага се на силно рестриктивни диети, които в крайна сметка ти водят до един йо-йо ефект. И всъщност това доведе до появата на тези промени в обмяната на въглехидратите, качването на инсулина, този йо-йо ефект, т.е. стремеж за бърз резултат. Всеки път се заклеваш как почваш много стриктно.
Стотици пъти се заклевам.
И всъщност
всяка сутрин започвам нещо.
Мотивацията ти изчезва следващите няколко дни.
This wave of young obese patients, it's a very dangerous trend. We will see our future heart failure patients now. One of the tasks of the Bulgarian Society of Cardiology is to work with leading international organizations like World Heart Federation to increase the awareness, to say to the people, look, that's preventable. We have to start early to prevent diseases. It's an educational process. It is not to stigmatize patients with obesity. It is to convince how important it is to have healthy lifestyle. There should be hope.
Няма как промяната да бъде бърза, но тя трябва да започне от някъде. Трябва да започне с информиране на обществото. Много е важно да разберем, че има начини да водим здравословен начин на живот, без да изпадаме в крайности. Без да соча виновници, смятам, че цялото общество трябва заедно да участваме в решаването на този проблем. Категорично. Много искам да намеря успешната формула, да бъда позитивна. Негативното си отношение към мен и моето тяло. Аз все още не съм отслабнала, но смятам, че има надежда.
Well, wow, what a powerful portrait of obesity there. And thanks to Gemma for outlining the exciting Facing Forward campaign. A warm welcome to you all from me, Jackie Thornton. Thank you to joining us today. I want to set the scene here. Gemma mentions COVID, and in the last year and a half, the pandemic has fundamentally altered aspects of life and society that we took for granted. But obviously today we're going to look at another silent pandemic that's been unfolding in slow motion for decades. And that's, of course, NCDs. Cancer, heart disease, respiratory disease, now including mental health, all fall under this umbrella. And just to give you some facts and figures, NCDs are the leading source of death, disability and disease, causing 41 million deaths each year. That's 70% of all deaths globally. And having two or more NCDs are the new normal in many parts of the world. And the worrying factor is that projections forecast that in the next 20 years, it's just begun. If current trends don't reverse, for diabetes alone, global prevalence will escalate from 463 million people in 2019 to 700 million by 2045. That's huge, huge numbers. And of course, look at the intersections between COVID-19 and NCDs. They both reinforce one another, making people living with NCDs more susceptible to severe symptoms and death from COVID, and just more vulnerable generally to disruptions to life-saving health services. And I think it's important to mention that as with COVID-19, we all face the NCD epidemic from very different starting points. Both disproportionately impact the poorest communities in every country, who are more likely to have high exposure to risk factors, such as unhealthy diets, lack of green space to exercise, air pollution, use of alcohol and tobacco. So now, today, it's time to focus on solutions. And Facing Forward aims to explore the innovative and vital work that organisations around the world are leading on to prevent and control NCDs. There are scalable solutions here. And I think the communities at the heart of these solutions, from Peru to the Pacific Islands, these films that Gemma talked about tell the real stories of real people who are drawing on collective action to ensure greater health equity and equality for all. So, of course, we have a fantastic panel, as Gemma says, who are going to share their various perspectives. First of all, we'll hear from Jane Demise, an NCD advocate from upstate New York, who will share some of her experiences of living with chronic kidney disease. Then we're going to be speaking to Dr. Phuc Hunyai, an eye health specialist and director of program implementation for the Fred Hollows Foundation, who will speak to us about healthcare challenges he's faced recently. Next, we'll hear from Raj Mariwala, who is Chief Executive of the Mariwala Health Institute, who will share insights on mental health care during the COVID-19 pandemic and how her organisation has adapted to meet the needs of local communities. We'll then be hearing from Carlos Meta from the International Committee of the Red Cross, who will speak about her experience of ensuring care for people living with NCDs in humanitarian settings. Finally, we'll be hearing from Annalisa Riel, President of the NCD Alliance, who will close the proceedings with some final observations and remarks. So I've got a few questions prepared for each of our panelists today, but we really do want to hear from you and encourage you to use the chat box to ask your own questions. So let me kick off, and I want to speak to Jane about her personal perspectives and experiences of living with chronic kidney disease. Jane, tell me what it's like.
Good morning. Well, it's a lot has to do with your attitude about living with chronic kidney disease. My story is a long one. I'll try to keep it fairly short. I was a very active person. I'm a person of size, but I was extremely active. And back in the early 2000s, I started having issues with my mobility. I was unable to walk. I was uncomfortable. And I went to the doctor, and the doctor just said, well, lose weight and you'll be fine. Keep losing weight. And here, take a mega dose of ibuprofen. That'll help you. And this went on for almost 2.5 years before my hands started to curl. And I said, these are not weight bearing. There's no reason why this has anything to do with my weight. And so they finally diagnosed me with psoriatic arthritis, severe psoriatic arthritis. And the remedy at that time, the prescription was methotrexate, prednisone, and the continuation of the ibuprofen, which now they know, they didn't know them then, what actually crashed my kidneys. They did rebound to a GFR of 41, what put me at a stage 3. At that time, the conversation again was not about lifestyle changes or anything, just lose weight, you'll be fine, lose weight. And that continued, and I constantly was dieting and trying to lose weight and struggled with that my whole entire life. And about 2017, I decided my kidney had progressed, as kidney disease has a decline. That's normal, but mine was kind of actively declining. Decided I needed to take care of this. I needed to take control. So I went back to my nephrologist and I said, look, we got to do something here. And she put me in contact with a renal dietitian who talked to me about lifestyle changes. And actually, it was kind of funny. The first thing she said to me was, you're not eating enough calories, which was like, shocking for a person of size to hear that. What I wasn't eating was the correct foods. So working with her and understanding the different effects of things like protein and carbs on the kidney, I was able to lose about 35 pounds and was doing pretty good. My kidney function stabilized. And then COVID came along, and here in the States, in my locale, they actually closed a lot of the labs and couldn't even get lab draws to see how my kidney function was. I put on a little bit of weight because the foods that I normally was eating was not available. And so at the beginning of this year, after finding out that I was at stage 4, I went back to the renal dietitian. She said, Jane, let's try plant-based. You can do this. And so I did. And it was quite a lifestyle change. I consume absolutely no animal protein, or try not to consume animal protein. And I've lost 50 pounds. I'm on a good projection to continue, and I've stabilized my kidney function again. So again, it is doable. It takes advocacy, patient advocacy. I had to stand up for what I needed, and I'm feeling pretty good about it.
Thanks, Jane. So, I mean, tell me, in terms of being people-centered when it comes to treating people with NCDs, how do you think that healthcare can become more people-centered? What does it mean to you?
The first thing is you have to learn to listen to your patients, and it takes both sides. When you go to see your doctor, you need to be prepared. Have a list of your questions. Have a list of your symptoms, because when you get there and the doctor asks you, well, what's going on? it's very common to lose. Well, I've completely forgot to ask them about those things. So if you are prepared when you visit your physician, then they can answer the questions that you have, and you can have a conversation at that time that's productive. It's also asking questions like, is this medication that you're prescribing, is this healthy for me? Is this actually not nephrotoxic? Is it safe for me, for my kidney function? Is it going to have any side effects that are going to cause more problems? One of the side effects of taking the drug combination that I did is that I had diabetes, ended up with diabetes. I don't have diabetes in my family, didn't have it before. My A1C went from 5 to 13, and that was a progression that I had to work at. And the good news is that I am slowly, I'm back down to about 5.9, hopefully working off the insulin.
Okay.
But it was
well done. A fantastic achievement on that, Jane. And it's great to hear that you did get the right help and advice and care in the end, but actually that it needs to be, everyone needs to contribute to that, and it needs to be more wide ranging. So thank you very much indeed for coming this morning to speak to us. I do want to move on to our next speaker, who comes from a different perspective now. We have Dr. Fook, who's Director of Programme Implementation in Asia from the Fred Hollows Foundation. Dr. Fook, tell me a little bit about eye care and how capacity or access can be increased at a local level. What are the biggest challenges and who's most affected?
Okay. Hello, everyone. So, okay, before that, I want to introduce one more time. My name is Phúc Huynh, and I'm working for the Fred Hollows Foundation. And for those who not know about the foundation, we are one of the biggest international eye health NGO, and we're working in more than 25 countries around the world. We were established in Australia 29 years ago. And our mission is to ensure no person is needlessly blind or vision impaired. Okay, respond to your question, Jackie. I want to show the relation between the eye health and the NCD. You know, the World Health Assembly resolution on prevention and control NCD in the year 2011 had made a formal recognition that the eye disease imposes a major health burden for many countries, and the eye disease to have the common risk factor, and also they can benefit from the common responses to the non-communicable disease. So to have something related. And many eye health conditions had fallen with the definition of the NCD, such as glaucoma, cataract, age-related macular degeneration, and refractive error that's called short-sightedness, that's on the NCD and can emerge over a person's life. And the most common eye health NCD, it often appears in one individual have the other NCD. For example, a series of popular-based study in the high-income country had showed us the people with vision loss, 27 had also the cancer, and 39% had the heart disease. So at the local level, we can see that there's something, you know, two-way causal link between the eye health and NCD. For example, if someone gets diabetes, so they can get to the diabetic retinopathy, or another condition, diabetic can cause to the cataract quicker. And a stroke can easily lead to the vision loss, and some poor mental health disorder can easily cause vision impairment. So that's either something related. So when we're doing things in the community, we try to combine the integrated eye care service into the overall health service, including the NCD intervention.
So it seems it's obviously such a complex picture there. And of course, then you've got COVID-19 coming into the picture as well. And how has COVID affected that implementation of integrating eye care into general health and NCDs?
Okay, COVID-19, it's like a monster to the world, right? Okay, and in the eye health, it's very simple. Like we often have some mass screening, like a week screening for the student in the school. And COVID-19 is banned on that kind of activity. We cannot gather the student anymore. Or we can do something like we send the mobile surgery team to go to the community to do the mass surgery. Normally we can do like 100 cases a day, but now that thing is never happened. People stay at home and we cannot do the outreach surgery anymore. And even the patient, they are scared to come to the hospital because they have to, go to all the health declaration and testing COVID. So that's why I can say the COVID-19 situation affects badly to the eye care service, and I believe to the other people with NCD condition as well.
So you don't think that there maybe has been a light bulb moment so that policymakers are prioritizing NCDs because of the COVID-19 epidemic? It hasn't. You're saying it's actually been, it hasn't helped as much as it might have done.
I do think the life should go on, should move on, and I think COVID it will last, but we can find a way to control that. So for the eye health and the NCD, we know that if the government of other countries don't take any further action, the global burden of blindness will be increased by 40% by 2050. And up to half of the world population will live in some form of vision impairment. So we do appealing to the government to priority building the healthcare team, priority the NCD, doing the integration of people center to the NCD intervention, including the eye care service in national health program. This will be counter the silo effects, and it will be improve the patient outcome, including someone who live with the NCD complication and multi-mobility. So that's our advice and our suggestion.
Okay. Well, thank you very much indeed for joining us this afternoon. It's great to hear from you, Dr. Hernay. And I now want to move to a different perspective now, to Ms. Raj Mariwala, who's going to give us a community view and some examples of the work that the In Health Initiative are doing. Raj, if you want to...
Sure. So I'm
remarks. Thank you.
Sure. So I'm the director of Mariwala Health Initiative, which is a grant-making and advocacy organization that works exclusively on making mental health accessible to marginalized communities through community-based grassroots interventions. Personally, other than being the director, I'm also a person who lives with a mental illness, a learning disability, as well as a practicing canine and feline behavior specialist. So you asked me, what the mental health fallouts have been. And like people have said before, the virus has disproportionately affected the most marginalized. Now, initially in India, the stigma around COVID, as well as the criminalizing of a public health response, such as calling people COVID suspects, meant that we needed to focus on some immediate stressors for mental health, as well as plan for the longer term. Part of this was really quickly repurposing funding as needed, which was then critical for a first response. And I'll give you an example. One of our oldest partners, iCall, is a national helpline that's free, that answers calls in 9 languages. And we did a fast infusion of funding, not just to keep the helpline running, but also to add capacity. Similarly, so with some of our other partners who worked in hard to reach regions, such as Burans that works in a hilly region. They started sharing information about COVID in their own individual settlements, and added paid volunteers who reached out within their particular communities to figure out how to support people who needed the support, not just psychologically, but also in terms of food and other concerns. Now, this network was critical because in a country like India, many communities, especially marginalized communities, do not have access to smartphones or even unhindered access to a regular phone. And so that means that the most marginalized communities who are most vulnerable to NCDs and mental health concerns also faced a heightened structural exclusion. So to work on mental health, it was very clear that we had to go beyond and also address lack of access to shelter, food for anemia, and because the public health system and distribution of medication collapsed, we had to organize for distribution of medication as well. So we actually had to go beyond traditional mental health support. And so the idea then was to work with a much wider range of not just mental health specialist organizations, but also organizations who worked on physical health, who worked on other issues with marginalized communities, because they knew where the needs were the most, and provide medication, transport, rent, food, hygiene kits, and then equip those organizations to do not just psychological first aid, but also mental health self-care for themselves.
So you really are talking about a multi-sectoral approach to this. What can you learn from how it did all work together? You obviously did have success in bringing those and enabling, you know, as you say, all those different elements to help people with mental health problems during the pandemic.
So, I mean, I think the one lesson is that COVID-19 really threw up the fault lines in our systems and our policies. And part of it was, you know, connecting the dots that NCDs, and of course, within NCDs, mental health, they are development issues, and we cannot really isolate them from issues such as human rights, a disaster response, livelihood issues, and of course, public health. And just to give you an example, a person's NCD symptoms can exacerbate mental health conditions, and at the same time, mental health conditions can be a risk factor for developing NCDs. Persons who live with mental health issues are much less likely overall to seek help for NCDs. And of course, then their mental health issues may affect the adherence to both treatment and prognosis. So this means that the physical health of those who live with severe mental illness is routinely and severely compromised due to inadequate prevention, late identification, and ineffective treatment plans. So I'll just give you a few suggestions. One is an awareness and knowledge of mental health needs to be built into physical care systems, linking mental and physical health systems by service delivery or additional support members to liaison between the two will also ensure better health outcomes. And again, an example, teenage pregnancies, substance abuse, and say SRHR concerns can be greatly mitigated with a supportive ecosystem rooted in family, communities, and public institutions. An organization called Sneha that we work with has done this, in fact, piggybacking mental health work onto work related to anemia, nourishment, and sexual health. It also means that including a mental health component may strengthen the efficacy of a physical health intervention.
Absolutely. Again, another very complex picture, very, very nuanced, but thank you very much indeed for bringing us that information, Raj, today. Let me come from a different perspective now. I want to introduce Ms. Carla Zveta, who is the International Committee of the Red Cross Primary Healthcare Programme Manager. So you've been present, I think, in Lebanon for over 50 years and responding to the Syrian crisis since 2014. I wondered if you could share some examples of how you've implemented a people-centered approach, please, Carla.
Yes, good afternoon. It's a pleasure to be on this panel today. So as you said, Jackie, the ICRC has started responding to the Syrian crisis since 2014. And after we started to implement our project, we came to notice that all the data available, the assessments done at the country level were mainly facility-based, and that patient's perspective did not really appear anywhere. And so the first step we took is to engage with the community that were in the catchment area of the facilities supported to try to move more into a patient-centered approach in identifying the needs, but also the gaps in our answers. And we were able since then to promote a model of care that does not address non-communicable disease in a vertical way, but rather to incorporate across the continuum of care. So we started by training community focal points to deliver psychosocial support sessions. We supported the healthcare facilities that serve the communities, physical rehabilitation centers where patients who often have disabling complications such as amputation were receiving prosthetic services. We integrated mental health and psychosocial support into our model after seeing how high the toll on mental health can be for patients living with NCDs, and which was noted by Raj just before. We tried to remove financial barriers for access to care through subsidization packages at the primary healthcare centers to make care affordable for the most vulnerable population. Right now, we're trying to include the NCD prevention in care, but also through sexual and reproductive health services, where we are targeting women as the nucleus of our society. They are the educators, they're the one that cook for the family, they're also the one that take care of the elderly, of the people with disabilities and people with chronic conditions. And to try to document and evaluate our model of care, we've been partnering since 2018 with universities like the London School of Hygiene and Tropical Medicine and the American University of Beirut. We're trying to we hope basically that by putting the patient's perspective at the center of research, we can bring some evidence to the global debate on how to build a humanitarian response that is really and truly patient-centered.
Well, it sounds like you're doing fantastic work, and you know, that's great. But I just wanted to ask you, Carla, I mean, what in the immediate and maybe the longer term it needs to happen to reduce this burden of NCDs for these refugee populations in humanitarian settings?
Yes, so as your question implies, NCD care requires to be addressed throughout the continuum of care. And we, in our activities, we divide them into mainly 4 points. So the first is the support to patient to ensure access to care. The second is to support to facilities to improve the quality of care. These 2 points are more immediate actions. And in the ICRC in Lebanon, we're trying to do this by these packages for care to make the care affordable for patients, and by supporting the centers with supplies, medications, which are necessary in the end to treat NCD like diabetes and hypertension, but also incentives for staff and training to ensure the quality of care. And on the more medium to long term, 2 other points like support to essential services for the promotion of continuum of care and supporting the health system as a whole to foster integration of care. These are mainly done through referral systems within the ICRC, with other humanitarian actors, and of course with governmental institutions like the Ministry of Health. And all this, of course, documented through research with academic partners.
Thanks, Carla. And as you say, documentation is really important, having that evidence base so that we can show that what you're doing is actually working. But again, it's this cross-sectoral, multi-sectoral approach that seems to be really important. And also, as you say, is that the patient-centered nature, everyone being concentrated on to actually get across that NCDs are really, really important and devastating for the people who suffer them. We've got a lot of points in from the audience, and I'm delighted that we have many people both online and watching it live here. So we have comments about from India: every 8 seconds a smoker is dying an untimely death due to diseases like cancer and NCDs. So we're concentrating on the tobacco. There are health policymakers to reduce tobacco cultivation as an answer, perhaps. We have curative services. There should be also prevention services at primary healthcare, especially post-COVID. And also someone talking about thanking us for the amplification of the stigma of COVID on positive and mental health issues. Again, we have talk about mental health again, how important interventions from top down as well as bottom up. And we have dental care should also be part of NCD care. So lots of great comments there. So a really wide-ranging discussion there from our panelists, and I want to thank all of them for coming today for this Facing Forward. But I want to now turn to some closing remarks. We're delighted to have Ms. Annelise Riel, who is president of the NCD Alliance and also former Secretary General of the Norwegian Cancer Society, who is going to give us some closing remarks for today's event. Annelise.
Thank you so much, and hello everyone. And yes, I am the president of the NCD Alliance and the former Secretary General of the Norwegian Cancer Society. And I am also a cancer survivor, so I have walked the walk. I want to thank you all for being here today for the launch of the Facing Forward mini documentary series. I truly believe it will help bring great awareness about the challenges that people living with NCDs face every day, everywhere. As you know, the film we've seen today is just one from the series. And I hope you are the same as me. I can't wait to see the others because it did impress me so much. As the mini film from today reminds us, change cannot be quick, but it must start somewhere. It should start with informing the public. I couldn't agree more. And in fact, that is the aim of the Facing Forward series. As already said, every year, 41 million people die from chronic diseases such as cancer, diabetes, and heart diseases, while many millions more continue to live with them. Every single one of them has their own real story to tell. With Facing Forward, we want to reach to the hearts and the minds of people, of decision makers, of those of politicians. We want to see a change. We want to see solutions. I hope that when people watch these films, they begin to realize, I'm not alone. I could have been, well, it could have been my story. This gives me hope. I see solutions now. And perhaps this is how the change will come. As more and more people come to see that we are all, yes, we are all affected by chronic diseases. We are all in it together. The stories and the experience shared by the panelists today impressed me a lot. And there were so many important facts and things said, so many takes away. I just want to mention a few. Patient-centered healthcare, multi-sectoral approach, integration NCDs with other diseases. But perhaps most of all today, again, thanks mental health. We do need to put it in the front. We do need to fight the stigmas. We do need to help that people affected with mental health get treatment and care the way they should, and that not COVID-19 is making the situation so much worse. And also the refugees situation. Too easily we forget that of course they need more than bread and water. Many, too many, live with one or more NCDs. They need treatment, they need care. And we do have to realize that, and we do have to tell politicians and others. I'll say for my own sake that the battle with cancer made me realize that there is no greater teacher than that of lived experience. That is why I stand behind the importance of putting the voices of people living with NCDs at the center of decision-making. This is something that the NCD Alliance has been working towards since its beginning. For example, in addition to Facing Forward series, we've also launched this month a global charter on meaningful involvement of people living with NCDs. This is something that we have created together with more than 500 people from more than 50 countries around the world. It is a roadmap to make meaningful involvement a reality. While it's true that change may not come quickly, I do believe that it will come. Thanks to the efforts of everyone here and to the many millions of people around the world. The voices of people living with NCDs must be the ones that guide us towards a healthier world with greater health equity and equality for all. Thank you.
Thank you very much indeed, Annalisa, for that heartfelt closing remarks. I just want to say thank you very much indeed for all your great comments. I just want to read one out before we go. One of our attendees has said, thank you for the insightful discussion and for putting people living with NCDs at the centre of care. Community awareness and prevention of NCDs is also key. So that's a great remark to end on. I want to say thank you very much indeed to my panelists from all over the world, to Jane from America, from Carla from Lebanon, to Phuk from Vietnam, and to Raj from India for coming here today and to give your expert perspectives. And also thanks to Gemma and to the BBC for producing that fantastic film that we saw at the beginning. As we see, there are many more to come, and I'm sure they'll be incredibly successful and powerful in getting across the nature of living with NCDs against a backdrop of COVID. So thank you very much indeed for attending. Again, you can see this on Facebook Live and the recording. So please do pass it on to others so they can experience the debate and the film too. Thank you very much indeed from the NCD Alliance and from the BBC StoryWorks. Good afternoon, good night, good morning.